My name is Kayli. I've been an SP for about 5 years, and I stick with it because it's a really fun and rewarding experience.
What I like about being a standardized patient is that it's another experience to learn from. You meet other doctors, you meet wonderful and excellent students who are learning every single day to improve their skills and be ready to become future medical doctors.
Typically, when you're being a standardized patient, you're given a patient case and you have some memorization to do to learn your role. And then once you're comfortable with that, you sometimes have some training with the teachers and faculty, and they'll answer questions you have and help encourage how you should be acting as the patient. If you're supposed to act certain ways when you're getting palpated or during the exam itself, if you're supposed to be grouchy or moody or happy or sad or nervous. And from there, then as you step into the room with the student, you know what you need to do and how you need to act.
When I applied for this position, I was looking for something, as needed, because I'm a retired nurse, and I didn't want a full-time position, but I wanted to do something that I actually wanted to do. Pay wasn't an issue, but I wanted to be paid for it. Saw this, applied for it, and I never looked back. It's actually been extremely rewarding working with these young people, helping them out, and maybe in the future they'll remember, I remember that specialized patient, and this is how they said it, and even down the line. So that's been extremely rewarding for me.
It's the diversity of the encounters. There's always something fresh. There's always something new to learn. It really keeps me on my toes. It's an ongoing process.
And I have fun. It's fun. You get to memorize, you get to improv a little bit. It's just a fun thing to do.
Yeah, I think, again, if you have any interest in that sort of thing, and you let them know, what your schedule is, if you're an at-home mom or dad or whatever your work schedule is, and you're interested, let them know, and they'll do their best to work you in to their schedule. I think that's the real beauty of this program, and we've appreciated it, as Jan said.
And they really appreciate the SP, so they're
Right.
so willing to work with us.
When looking at this particular program, I thought, boy, this would be something that I think would be very rewarding, and I found out that it actually was.
There are a lot of positions out there, but the reason why I chose working at the Medical College of Wisconsin is that it's a unique and appealing experience.
I'd say just try it. Like, once you do a couple of them, you'll start coming back.
I highly encourage anyone to be a standardized patient because you're helping the future doctors grow in their field.
Go for it, try it out. It's not a huge time commitment. You get to pick your time slots, and healthcare is essential.
And honestly, it's just people skills, which I know every single person has. And that's all you're really giving for feedback is, how do they do with their people skills? So anyone can do this.